Well, thank you very much for the questions. I also, as indicated, have got very educated, very learned experts here who are going to help me. In terms of the stigma issue, indeed, that's a matter which we're trying to manage very carefully, not to exacerbate. But at the same time, it is important to mention the people at risk, so that those who are part of those key populations at risk should not also hesitate, especially when they do experience symptoms, but also try to reassure, and also for our frontline health workers also to be empathic to the users of our health services, and make sure that no one is treated with a stigmatization. But it is important to always also highlight where particular members of our community are at higher risk. Now, we know that, for instance, from as I've said, from one of the patients who was more open about, his sexuality and relationships, while others were not as open. This particular one, as I mentioned in the statement, did confirm that he has multiple partners, both male and women. So in that regard, coming to your next question, it's not very easy to actually get full disclosure and be able to get all the contacts. It's much more easier in terms of family, because family is family, and if they are living together, that's why in the statement we do mention where family contacts have already been screened. Also in terms of health workers who are caring for the patients. But when it comes to the fact that the reality of this being that it's not an infection which you can acquire simply by being in one room, unlike what we had with COVID and influenza and other aerosol spread illnesses. This one is strictly, there must have been contact between people on a skin-to-skin contact level. So that makes it quite difficult in terms of fully to be confident. But nevertheless, we are hoping that through the various media platforms through which we are trying to communicate, but also using also the other forums, as I've indicated, organizations in civil society, where people who in one way or another associate and work together. We are hoping that through those we will be able to reach more people. In terms of if we say there is no travel, I'm sure my expert colleagues here who have more experience, both from the NICD and WHO, might be able to assist us. All that it indicates, I mean, as I'm sure they are experts, they will explain better than me. But just from my own knowledge, we had outbreak in 2022. Then there was a whole year of a lull. Now, the problem here, there may be two. One is that, I think that Dr. Meyer from the NICD might explain a bit better. I'm not sure as to what extent the monkeypox virus can lie, latent for how long before it shows. That might be one, and she will tell us a little bit more. But also, the patients themselves may not have traveled, but it is not impossible that they may have been in contact with a traveler from a high infection country. So the person may not have traveled, but even if you haven't traveled yourself, we know that even with COVID, when it first broke out, there were people who had gone to other countries and come back, or they've traveled. But later on, because of interaction between those who have traveled and those who never traveled, it then became endemic. So even in this case, it may be that it might have been lying latent for some time. That I'm not an expert in that, but also it may be that the patients may have had contact with travelers who we have many travelers coming to the country, and all sorts of possibilities are there. I'll leave out the issue of the flu outbreak. I know the NICD does brief us, that they do the surveillance, and from time to time they update us if there are any new variants, influenza variants. I know that anecdotally, I did also ask some of the members from the department to check. I did get reports about outbreaks of flu in various schools, but as to whether there was something uncharacteristic about it, I think the experts will indicate. In terms of the vaccines, again, as I've indicated, we are working with the WHO, so this is not going to be a procurement. It's going to be donations from member countries coordinated by WHO and also Gavi. So I think in a matter of days and weeks, this should be able to materialize. I may not be able to say 2 days, 3 days, but because the negotiations are ongoing, we should be able to, and we do have the go-ahead by SAPRA to can access those vaccines. So that should be doable. I know there's a gentleman who sneaked in the issue of unemployed doctors when we are not here for that. Well, there has been a lot of progress. I think we did. I think we did issue a statement updating. There were still problems in the Eastern Cape until recently, and I did ask our Dr. Mahlati from our department and his team, the DDG for Human Resources for Health, to assist, because the problem in the Eastern Cape was not lack of funds. It was just in terms of activating the systems and making sure that the applications which were there are being processed. The provincial treasury was the most proactive of all provinces, because when there was an allocation of just over 3 billion additional from the treasury, the Eastern Cape treasury had actually directed the department to ring fence about 300 million to address the issue of the unemployed doctors. But unfortunately, there were weaknesses in the HR section of the department, and that's why I asked that our team should actually work with the Eastern Cape to assist to speed up the appointment of those doctors. But over and above that, you will always find a sprinkling of remaining problems here and there. And I can explain also, just to say, even though since the matter was highlighted early in the year, in total over 1,200 appointment of doctors was made. But because once the announcement was made that there will be funds available, even doctors who had left the public service a long time ago, some who had even gone into private practice and got frustrated, and some who might have even left the country and come back, they also now were competing for the very posts which we thought will be earmarked for those recently qualified from community service. So the uptake became much higher than the numbers which we had been given by both the South African Medical Trade Union and also South African Medical Association. So the numbers got higher because of those who were also now looking for opportunities in the public service, which is good that there is more doctors who want to, even those who had left, who want to come back, but it just puts more pressure. But as you would be aware, except for the Eastern Cape, the bigger noise which was in KZN, I'm assuming that it's been resolved because there was an agreement between the doctors and the province in terms of how the posts are going to be advertised and filled up. I think it must have been done by now. We didn't have any further complaints from any of the organizations. So I want to believe that that's a matter which has been resolved. Can I ask our two experts, I don't know, Dr. Meyer, you'll come in first, just on the issues which you might want to give us more free education.
Thank you, Minister. Heidi, I'll get to your question first. I'll just add to what the Minister has commented on the issue of stigma. So the issue of stigma stems beyond the issue of the at-risk population. It's also the unfortunate naming of the disease. So you will remember that the name of the disease was actually changed from monkeypox to mpox. So just in the name already there's a negative connotation. But we ask you as members of the press to assist in really, drawing down stigma. It's a destructive behavior. It really affects how people seek healthcare. It affects how people respond to their health needs. And you're a very important partner in making sure that the correct information is shared so that there's no place for stigma. In terms of contact tracing, Heidi, contact tracing is absolutely dependent on the information that's shared by the patients. They do also have their right to privacy, so unfortunately you do find situations where people might not want to disclose all of their contacts for whatever reason. And unfortunately we need to find ways around that. And try and be as thorough with contact tracing as possible, but there are restrictions. It's not only experienced in South Africa, something commonly experienced within the multi-country outbreak history so far. Corinda, I think you asked about travel histories. So as the Minister explained, mpox is not a disease that you expect to find in the South African population. We are not an endemic country. So endemic countries are countries where you can find the natural reservoir or host of the virus. So this is a virus that actually can spill over from animals to people. It only happens in those countries that are endemic. And in the multi-country outbreak, we saw mpox spreading beyond the endemic countries with sustained human-to-human spread. So in South Africa, we don't have zoonotic transmission. You can help to spread that message. So it's human-to-human transmission. If somebody didn't acquire the disease where mpox is being reported in other countries, it means that they must have acquired it locally. Now, those chains of transmission can be very short. Our investigations will still tell us that, or it could be longer. We don't know yet if we had sustained transmission from 2022 when we initially diagnosed cases in South Africa straight through to the current situation. I doubt it. I think we would have detected it. I think it's probably, and this is just my intuition as a scientist, we will see what our investigations tell us. My intuition is that there's been a more recent introduction. Could have been one person coming from a country where mpox is being reported, and then the disease spreads in the contacts. But our investigations will still clarify that over time. Why is mpox important? Why is it a public health issue, Corinda? We unfortunately already had a death. We need to, and it's one too many. we understand that we live in a population that, unfortunately, we have a high frequency of HIV, and we're seeing high frequency of unmanaged HIV. So people need to be encouraged again to know their status and to act on their status if they test positive. So within the South African context, where we have a high level of immunosuppression, we do need to consider Mpox and all other diseases that can affect our people as important public health issues, and hence the response that the Minister has described. Mpox versus COVID-19, Corinda, I think that was also from you. So the way that Mpox spreads is much different from COVID-19, and although we have seen a multi-country outbreak, it's far from the extent that we saw with COVID-19 or other respiratory diseases like influenza. So it's very different in the way that it transmits. It's very different in the number of people that are affected, and it should actually theoretically be more easily contained compared to something like COVID-19. So I hope that answers your question, Corinda. Calvin, I think your question was answered about the vaccines and also about the unemployed doctors. Thank you.
Anything on the flu?
Anything else from the floor?
The flu.
Flu, sorry. 1 second.
There's a question about the flu, whether there's mortality.
Oh, the current flu season. Yeah. So winter season is flu season in South Africa, so we know that and we expect that. The rumors are that we are experiencing a more severe flu outbreak. To my understanding, not being a flu expert, but being a zoonotic disease expert and an Mpox expert, my understanding from the surveillance reports is that there's currently not a signal showing that it's something or a very significantly different flu season. But do please keep your eyes on the NICD website and also the communications through the Department of Health. This is continuously monitored, and we're able to quickly report if there's any changes in our findings.
Okay. Yeah, you can come back. Yeah, I'm going to allow the WHO, Dr. Fabian, to also make some inputs.
Thank you, Foster. Thank you, Honorable Minister. I will add a couple of few inputs, particularly on the treatment and also on the vaccines. Then I will also invite my colleague, a technical lead, Dr. Wamala, to add a couple of few comments on, I think, one or two questions from the audience here on the outbreak definitions on the Mpox. So in terms of treatment, as the Minister said, we are working very closely with the ministry team and also partners to make sure that as much as possible, as soon as possible, we get the drugs available to the patients. As we speak, 10 doses have been packed, just waiting shipment from Geneva to here. So we're working with the team to make sure the paperwork is actually done and this shipment can actually be available. But also more other doses to be ready and be made available as soon as they're required. On the vaccines, as you know, Mpox has been around quite some time, as the Minister said, since 2022. It was a global public health emergency, and several countries were affected. And so there are several countries with the vaccines actually made available. So we will continue to work very closely within our team, but also working with our regional office and headquarters and other expertise to make sure that these vaccines are also made available in the country as soon as possible. So with those two, let me invite Dr. Omala to provide some response to specific questions on the surveillance, but also the case definition on the outbreak. Omala.
Thank you, Dr. Fabian. I've been asked to comment on the definition of the outbreak, and the definition is informed by the information that we've learned since the multi-country outbreak started, and these definitions continue to be updated as new information becomes available. So currently, when we detect at least 2 confirmed Mpox cases in a country, even when they are not epidemiologically linked, that country is believed to have an outbreak. So we have threshold. So once at least 2 cases are reported, we believe we have an outbreak. We've reported 5 cases in South Africa. All these cases have no, as the minister indicated, they have no history of international travel. So that really speaks to transmission that has probably not been picked. So even when we have 5 cases, that is already a sign that we potentially have a very big outbreak on our hands. You've also noted from the minister's update, there have been 38 contacts listed for the 3 cases in KZN, and only around 8 for the 1 case, first case confirmed in Gauteng, and the process is still on to identify the contacts for the 5th case that passed on. So that also shows you that, and many countries have experienced this. It has not been easy to identify the contacts, and even from this press briefing by the minister, you can clearly see there are constraints in actually identifying the contacts. But as the minister has indicated, it's really very important that we all remain vigilant. We should be aware of the symptoms and report promptly to the clinics for checkup. The health workers are professional. They are trained to maintain confidentiality for all the information shared. There is also an advantage in seeking care early because you can get tested early, and if you are confirmed to have Mpox, we now know that there is some treatment that can be given, especially for severe cases. This treatment actually works better if started early during the course of the illness. There's been also a question on vaccines. Yes, vaccines is one of those tools that we are really using to ensure that within the next 2 years, we eliminate Mpox. So WHO last month released a global strategy to eliminate monkeypox outbreaks or cases globally. And one of the core interventions to this strategy is the use of the Mpox vaccines. The Mpox vaccines will not be used as we did for the COVID-19 vaccines. So we'll not be doing mass vaccinations. But as the minister has indicated, we will actually do targeted vaccinations, what we call pre-exposure prophylaxis vaccination for high-risk groups. And I think these have been well identified in the context of South Africa. We continue identifying this as the epidemiology, we get a better understanding of the epidemiology of Mpox in the country. But as the minister has indicated, currently we are looking at vaccinating key populations, health workers, laboratory workers, and that criteria will be improved as more information becomes available. There was a question on how soon vaccines will be here. The minister indicated that there are bilateral discussions with countries in Western Europe that have stockpiled vaccines beyond their country needs, and those vaccines may expire if they are not used. So those bilateral engagements are ongoing with support from WHO, and if those bilateral engagements with countries in Western Europe go very well, maybe even within the next few weeks, as the Minister has indicated, the vaccines will be here. There's also an option of doing bulk procurements from the manufacturers, and the lead time for vaccines being available from that channel depends on how soon funding can be made available, for example, from the Treasury to support procurement from the manufacturers. Thank you very much.